Good morning. It is Boxing Day 2023 and I just want to share my journey. I've decided to do a vlog because it's really lots of things are coming up and decisions have to be made, etc. And I just thought I'd share that in a vlog because I would appreciate seeing. So my story starts with 2020. I was diagnosed with left breast invasive ductal carcinoma, estrogen positive, and they took that out, the lumpectomy. They just took the thing out, which was great. The lymph nodes were clear, so that was awesome. And then I did have radiation after, which I kind of regret now, but we'll go into that more. Anyway, then in 2020, I had a giant tumour on my left ovary, and I had that taken out. They thought that was cancer, but it wasn't. That was a miracle. And then this year, I had this funny little lump on my left breast above where the other surgery was. And doctor said, because I'm the best doctor, Dr. Kelvin said, well, let's get it checked out. We'll send you for an ultrasound. Probably nothing, safe rather than sorry. So I went for the ultrasound, and it was nothing. Yay, but they found something on this side. And so the reports here that came back was comment, 10 millimeter likely carcinoma focus, right 10 o'clock position. Ultrasound guided biopsy is indicated. They also found a funny lymph node. So they said irregular tall lymph node with right axilla has been identified, and it suggested a fine needle aspiration as a precaution. So that was December 14th. I went for that. And then they booked me in on December 18th, which was my 68th birthday, for a core biopsy and a fine needle aspiration. So I did that, and this is all happening very quickly, 14, 18. And I think it was like the next day or the day after, my doctor called me and said, could I come in to discuss results? And that's never a good sign when they call you straight away. But anyway, so I went in, he said, yeah, he had this conclusion, right breast, 10 o'clock, malignant, invasive ductal carcinoma, grade 2, ER triple positive, PR negative, HER2 dish pending, or HER2 equivocal, meaning there's some, I think, but, okay, and then we said, well, I was looking on the right side, at least the lymph node one didn't come back, and that probably means it's okay. Until the next day when we got the lymph node report back that said, conclusion, malignant, metastatic carcinoma, cytomorphology in keeping with metastatic breast cancer, breast carcinoma. So that wasn't real good news. And then Dr. Kelvin rang me back and he says, let's send you for a CT scan just to see, because you can tell if it's where it's spread. So in for the CT scan. This is all within the same week. Like, started, yeah. Anyway, and then the CT scan came back, and he called me again and said, it's not real good either. It looks like it's gone to your liver and lungs. So, yeah, I'm not going to read out all this because it's mildly enlarged subcardinal and bilateral high lymph nodes with poorly defined. I don't even understand all this. Small bilateral pleural effusions, blah, 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 suspicious for pleural metastatic disease, 16 millimeter lesion. I think that's a nice word for tumour, I'm not sure. In segment 3 of the liver, new since prior imaging, most likely liver metastasis, small volume retro perio something lephanos blah, blah, blah. So it's not real good prognosis. Now, I want to document my journey, one thing, because I want everyone to see what I go through, because I have no idea yet. My reality changed from my reality, which I was going to go away in my van down south in WA for the summer, spend the whole summer down there, to a breast care place calling me saying, you know, you need to have a PET scan. PET scan's the next step. You need to have a PET scan straight away so that the doctors can get a head start on this, and the doctors, because it's Christmas, doctors aren't back till January 8th or something. So but apparently they can do the PET scan before that. Then the next meeting of the doctors is January 12th, and they will decide on my treatment plan. Now, the treatment plan is going to be the tricky thing, because I don't want conventional treatment. I don't believe in, this is just for me, I'm not saying for anybody else, but for me, I've never seen chemotherapy really help people that much, and if whatever's going to happen with this, I can do this naturally, and that's what I want, which I know the doctors won't like, because last time they wanted me to have hormone blockers, and I looked up all the side effects, and I just couldn't do it. I couldn't do it. Anyway, then when I had my ovaries out and everything with the radical hysterectomy for that other tumour, I thought, well, that was pretty good estrogen blocker. Still, I came up with this. And I read, where can you get estrogen from in your body besides your ovaries? And apparently your fat cells can distribute it. So, yeah, maybe that's what's happened. Because after I got better from the other cancers, I let my diet go. Like, for a while I went no sugar, I was juicing, everything was great, but then I started eating chocolate again, and I just love chocolate-covered licorice, and anyway, it sounds all yucky now, but yeah, I have an addiction to sugar. So that's going to have to go, because sugar's no good. I've got a lot of dietary changes to make. I'm already juicing, I'm doing green juices, I don't do meat, so yeah. And I haven't really noticed any symptoms except a funny little dry cough, which the doctor said could be because there's fluid in my lungs. So let's see where this journey takes me. I'm also into things like ceremonies with the beautiful Mandy J, and amazing things happen in ceremonies. I believe that my Creator can cure me. I believe that we have everything in our bodies, if that be in my Creator's will. But I don't want to do the chemo. I don't want to be a chemo sick person. And I don't care about losing my hair, but yeah, it just doesn't feel right. So it's going to be an interesting journey to see, because I know the doctors probably won't like my decision to do that. I think they want to get me in there and bombard me with drugs straight away. I've been online. I had a thing in my head to get folic acid last week. I don't know why, but it was just a thing. Go get it. So I did get it, and so I think that's a good thing for me. I haven't researched it that much, but it sounds really good. And yeah, get back on the blueberries, the raspberries, the Brazil nuts, all those things with the allergic acid that stop the cancer cell growth production, and there's a lot of it. The stuff that's in the skin of the grape, the reversatol, I think it's called, something like that. Oh, hang on, someone's at my door.
Sandy.
I'll get back to you. Hang on.